Upper limb surface anatomy. The arm. Scapula and humerus. Palpable structures. Coracoid process. The tip of the coracoid process is palpable immediately below the lateral third of the clavicle and deep to the medial margin of the deltoid muscle. To palpate the coracoid process, place your hand on the deltoid muscle and grab it with your thumb. Your thumb will now be in contact with the coracoid process. Greater tubercle of the humerus. The greater tubercle of the humerus is lateral and projects beyond the acromion. It forms the roundness of the shoulder joint. Grasp it through its covering deltoid muscle. Lesser tubercle of the humerus. The lesser tubercle of the humerus is infralateral to the coracoid process and points forward. Palpate it sliding beneath your fingers while you medially and laterally rotate the humerus. Angle of the acromion. Palpate the angle of the acromion with your thumb and index finger. This is an important landmark from which measurements down the arm are made. Surgical neck of the humerus. Palpate the surgical neck of the humerus. It is covered by the deltoid muscle, but it can be palpated quite easily, as it lies approximately 5 cm below the angle of the acromion. This is important since it is a site of fracture and is related to the axillary nerve and the circumflex humeral arteries that pass from medial to lateral behind it. Epicondyles. Palpate the medial and the lateral epicondyles of the humerus. The lateral epicondyle is the common origin of the forearm extensus. The medial epicondyle is the common origin of the forearm superficial flexus. The ulnar nerve passes posteriorly to the bone and may be damaged here. Muscles in motion. Biceps Brachii Muscle. The biceps brachii muscle has 2 heads, a long head and a short head. The long head arises from the supraglenoid tubercle of the scapula. It is intracapsular and extrasynovial. The short head arises from the coracoid process of the scapula. The biceps brachii muscle inserts to the posterior border of the bicipital tuberosity of the radius, and to the bicipital aponeurosis to the deep fascia and subcutaneous ulna. The biceps brachii muscle supinates the forearm and flexes the elbow. Note, the biceps brachii muscle supinates most effectively when the elbow is flexed. It also weakly flexes the shoulder. The musculocutaneous nerve that originates from the lateral cord of the brachial plexus innervates the biceps brachii muscle. Biceps brachii muscle. Long head tendon tear. Tearing of the long head of the biceps brachii tendon is by far the most common serious sports-related biceps injury. A sudden backward movement of the arm places tension on the long head of the biceps brachii, most often where the tendon passes through the bicipital groove of the humerus. This movement is relatively common in cricket, baseball, tennis, and also in weightlifting. Coracobrachialis muscle. The coracobrachialis muscle arises from the coracoid process of the scapula with the biceps brachii muscle. It inserts into the upper half of the medial border of the humerus. The musculocutaneous nerve that originates from the lateral cord of the brachial plexus innervates it and also runs through the coracobrachialis muscle. The coracobrachialis muscle flexes and weakly adducts the arm. Brachialis muscle. The brachialis muscle arises from the anterior lower half of the humerus and the medial and lateral intermuscular septa. It inserts into the coronoid process and tuberosity of the ulna. The musculocutaneous nerve that originates from the lateral cord of the brachial plexus innervates the brachialis muscle. The brachialis muscle flexes the elbow. Brachial artery. The brachial artery is the continuation of the axillary artery beginning at the lower margin of the teres major muscle and ending in the cubital fossa at the level of the neck of the radius, as the radial and the ulnar arteries. It is superficial throughout its course and is accompanied by venae communicantes. Soon after its origin, it gives off the profunda brachii artery, which passes laterally with the radial nerve into the spiral groove. Palpate the brachial artery on the medial side of the arm, in the cleft between the biceps brachii and the triceps brachii muscles. The median nerve courses with the brachial artery, whereas the ulnar nerve deviates posteriorly from it in the distal arm. The brachial artery passes anterior to the elbow joint and bifurcates in the cubital fossa into the radial and the ulnar arteries. Triceps brachii muscle. The triceps brachii muscle has 3 heads. The long head arises from the infraglenoid tubercle of the scapula. The lateral head arises from the upper half of the posterior humerus, superolateral to the spiral groove. The medial head arises from the lower half of the posterior humerus, inframedial to the spiral groove. The 3 heads converge and insert to the posterior part of the upper surface of the Acromion process of the ulna and the posterior capsule of the elbow joint. The Acromion is palpable and forms a bony protuberance at the tip of the elbow. The triceps brachii muscle extends the elbow. The long head stabilizes the shoulder joint. The medial head retracts the capsule of the elbow joint on extension. The radial nerve, which arises from the posterior cord of the brachial plexus, innervates the triceps brachii muscle. Triceps brachii muscle, long head tendon tear. The long head of the triceps brachii muscle is the most frequently injured muscle during back lateral pull-downs with heavy weights or during chin-ups with added weights. This tendon may partially tear, most often close to its insertion on the scapula. Radial nerve. The radial nerve arises as a continuation of the posterior cord and descends posterior to the axillary and brachial arteries. The radial nerve passes inferior to the tendon of latissimus dorsi and teres major muscles to run with the profunda brachial artery between the long and medial head of the triceps muscle and through the lateral triangular space. The radial nerve is palpable as it runs over the spiral groove of the humerus between the medial and the lateral heads of the triceps muscle in the mid-third of the humerus. With your fingertips, try to roll the radial nerve where it runs vertically in its spiral groove on the back of the humerus and below the insertion of the deltoid muscle. Radial nerve injury. Fractures of the mid-shaft of the humerus can damage the radial nerve and the profunda brachial artery and vein. The radial nerve supplies all the extensors of the upper limb, including those of the wrist. Damage to it causes the forelimb to adopt a characteristic position with a flexed limp wrist, i.e. wrist drop. In this state, grip strength is lost, since for maximum power in the digital long flexes, the wrist has to be held in extension.